Good afternoon. Thank you for attending our EMS Program Advisory Committee meeting on April 21st. I'm sending this out in advance for you to review. It is mainly focused on a program update as well as program outcomes. Please review this before you come to the advisory meeting. Our advisory chair will go over the minutes of the advisory meeting as well as we'll do introductions and review the agenda. Just a reminder that our vision statement is changing lives and building community, and we in the EMS program take that very seriously. Our mission statement at CNM is to be a leader in education and training. Our CNM core values are listed there for you to review. What we need from you, we need open and honest feedback about what we are doing for the community, as well as what kind of EMTs we're producing for the state of New Mexico. We will have discussions about how to work together for support in clinical and internship opportunities. We want to make sure that we are partners in the educational process. We welcome your feedback throughout the year. Informal feedback is just fine, email or conversation, and summative feedback via advisory participation and completion of our surveys that we have here today. Purpose of the meeting, we want to make sure that you're aware of program operations. We want to update you on the paramedic program changes that we made last year. We want to update you on our National Registry pass rates, especially AEMT or EMT intermediate pass rates from last year. We want to show you what we've done regarding behavioral issues in the classroom. Hopefully that is transitioning over and being helpful in the field. But at the end of the day, what we really want is this meeting to be a means for CNM to listen to community needs and your expectations. We also want your input regarding future planning at CNM. We will need you to complete several surveys. I apologize, but it is necessary for our accreditation. We want to talk to you about our new program goals. We'll review last year's goals to see if we met them. And please make recommendations for our program. At the end of the meeting, we would like for you to meet with our students. So from last year, one of our ongoing goals that we have to present to you every year is the one regarding preparing competent entry-level emergency medical technician paramedics in the cognitive, psychomotor, and affective learning domains, with or without exit points at the EMT intermediate and or EMT basic level. This is an ongoing goal. One of last year's goals, to increase paramedic level program retention by 5% in 2016. So last year, we had a 61% retention rate in summer and a 71% retention rate in spring. As of fall, we accepted 15 through our new entry process, 12 enrolled, and we have 8 currently. So although we did meet our 5% retention increase, we still would like that number to come up. In spring 2017, we had around 24 applicants, 14 were accepted after the initial testing process, 12 started the program, and 11 are still enrolled, so we're at a 92% retention rate. One of our other goals from 2016 was to increase the National Registry pass rates at the EMT Basic and AEMT by 5%. They did increase, however, they only increased by about a percentage point. So fall 2015 through fall 2016, the reason we chose this timeline is also the reporting timeline required for the New Mexico Joe. Our EMT Basic program pass rate is 84%, and our intermediate pass rate is 78%. Here are our goals for 2017. Again, it is our accreditation goal regarding preparing competent entry-level paramedics in all 3 learning domains. Other goals, we would like to increase our National Registry pass rate by 10% over the next 3 years. We still want to improve our process and policy to address behavioral issues in class, clinical, and field. We do want to collect data on our paramedic entrance process regarding retention. So to elaborate on that, we did make some changes to our entry process as well as our term by term as required by National Registry, as well as CAHEP accreditation. What we'd like to do is collect data on if we are retaining the qualified candidates, and we have already begun doing that. We would also, with your input, like to work on a way to offer high quality continuing education and non-credit education in an effective way that is a reasonable cost. Just some reminders about the entry requirements. I do get this question quite a bit, and unfortunately, sometimes it's a little too late since our enrollment starts about 3 months at least before the semester starts. So I want to make sure that everyone knows what the entry requirements are to get into our intermediate and paramedic programs. So intermediates, they have to have completed their EMT basic. They can fill out our pre-screening form with a certificate of completion only, but they do have to be licensed by week 2. They do have to complete English 1101 and Health 1001. They have to be registered for Math 1210. They do have to complete the pre-screening process, which I can show you at the advisory committee meeting. If they've already taken their EMT basic either a while ago with CNM or if they've taken it at another institution, we have a very simple form that they fill out and they get credit for the coursework at CNM, that is EMT basic coursework. We do give priority registration for licensed basics, and we give higher priority registration for experienced licensed basics. When they get accepted and they register, it's a 2-semester program. They take their lab and theory first. Once they pass that, they take their National Registry Psychomotor exam, and they also are moved into the clinical realm where they take their clinicals in term 2. After they complete their clinicals, lab, and theory, they're eligible to sit for the cognitive exam for National Registry. Paramedic program entry requirements are listed here. They must have a 2.5 GPA. They must complete the FSDAP entrance exam. They must successfully complete 2 graded scenarios after the pre-screening process has been approved. The prereqs that they have to have, we have slimmed this down since last year. They have to have English 1101, which they have to have as an EMT basic at CNM anyway. They have to take a higher level math requirement, minimum of Math 1210. They have to take Psychology 1105. Health 1001 is now an online course with a skills checkoff, and they also have to take that for EMT basic anyway. And they have to take Biology 1410. So they have to have these things done in order to fill out the pre-screening form to enter the paramedic program. We do take paramedics twice a year. The EMT basic, they still have to have a course completion, but they do have to be licensed by day 1 of the program. This is verified by our Office of Coordinated Entry as well as at our program orientation. Again, we do offer priority registration for experienced providers, and we do have the credit for prior learning process for anyone who took their EMS coursework at other institutions. They must fully complete the pre-screening form in order to be able to register for the paramedic program. This is just a reminder of what our term-by-term looks like. So it is a 4-term program, but we did decrease the credit hours in every term. This was based on community and student feedback regarding the course load in our previous program. The 10 credit hour, 11 credit hour, 11 credit hour seems to be more manageable for the working person. Also, we had to arrange our program in a way that our capstone field experience was an 8-week experience. And the only way that we could fit this in effectively was to arrange our program, as you see here, in a 4-term format. Our students, when they graduate, are awarded an Associate of Applied Science in Emergency Medical Services, and they are also eligible to test for their National Registry. This is just a reminder that we are working under the auspice of the National Registry Psychomotor Competency Portfolio Package, and we designed our program to ensure that it fits amongst the phases that you see here, where the capstone field internship is at the end of all lab and didactic training. We would like to hear feedback at the advisory about the new design of our program, and we will also hear from the students at this meeting regarding the new design of our program. This is just information for you to note what you can expect that students have experienced at minimum upon graduation. The students have to have 30 intubations with the last 9 out of 10 attempts being successful. They have to have 50 airway managements with the last 20 out of 20 attempts being successful. This also applies to airway management that occurs in the field or clinical setting, which means that we bring them back after the field or clinical setting to ensure that they get that done in a capstone classroom setting. They have to have 10 team leads in lab, 50 successful leads in internship, with the last 18 out of 20 being successful. And they have to have 10 successful team member evaluations, which has really been eye-opening and important for the students to recognize how important it is to be a good team member as well as a team lead. So overall, the psychomotor competency portfolio is definitely aligning with what we do in industry. They have to have 25 medication administrations, 5 live BVM ventilations, 20 IV or IO placements, 12 total pediatric patient encounters, 40 adult patient encounters, and 50 internship team leads. Again, these are all with live patients. An update regarding National Registry testing. Previously, the students were testing out on 12 individual patient care skills. This is directly from National Registry. So moving toward the goal of assessing candidates in an environment which better simulates what we do in the out-of-hospital setting, they changed the examination process a little bit with the idea that team leadership and scene management is more important to test rather than 12 individual skills. So now the psychomotor exam includes patient assessment trauma, dynamic cardiology, static cardiology, oral board A and B, and the new thing is the integrated out-of-hospital scenario. This is an excellent representation of what we do in industry. However, it does take quite a bit more resources for an educational institution, and it also takes quite a bit more time. It includes multiple facets of patient care. There are instances where the scene has to be secure regarding a barking dog or an unsafe situation in the home, which is much more realistic than previous. The out-of-hospital scenario has a candidate, it has a live patient and a team member. This presents the candidate with a pediatric, geriatric, or adult patient and evaluates his or her ability to manage a call, lead the team, effectively communicate, and maintain professionalism throughout this encounter. There are 7 previously tested skills that are removed from the psychomotor exam and now are included in the out-of-hospital scenario. Just an update on that to ensure that you are aware of how we are testing these students at the end. And this is done via National Registry. This is not done by the school included in the program. It is the National Registry exam. So moving on, I wanted to update you on our program outcomes. So the EMT basic pass rate, fall 2015 through current, we've had 442 students attempt the EMT basic National Registry exam. 83% of those have passed. That is our update for fall 2015 through current semester. Our intermediate pass rate, we've had 146 students with a 79% pass rate. That did go up 2% since last year. Regarding EMT intermediate, we came to you as a committee last year asking for solutions and assisting us with a plan to increase that pass rate since EMT intermediates are in high demand. What we have done is there is a review as a part of the EMS intermediate clinical, since that is the closest to their cognitive exam. We do ask the students take the FSDAP exam twice in the clinical term. That way it gives the students a learning prescription to study from and improve their exam score. Long-term solutions, what we're looking at is changing our clinical hours to a clinical intensive, which will increase the contact hours and allow us to implement a little bit more classroom time to review, to keep the students engaged with information that they will likely be tested on for National Registry. An update on our outcomes at the paramedic level. Since 2015, we've had 49 attempt the exam with a 100% pass rate at the paramedic level. Overall 3-year average we're required to report out on for accreditation purposes. Overall, in the last 3 years, we've had 609 students attempt the EMT basic exam. First attempt pass is 74, cumulative pass within 3 attempts is 85%. The intermediate 3-year average, we've had 220 students attempt. Their first-time pass rate is not so good at 65%. Our cumulative pass rate is 81%. Again, we want to see those numbers grow over the next 2 to 3 years. Some of the students did not complete within 2 years. Many of the students decide not to take this exam once they've been accepted to paramedic school. We have been meeting with the students individually to talk about the benefit of completing their intermediate license. The paramedic 3-year average, 72 paramedic students have attempted the exam with a 100% pass rate. Just to discuss our medical director, Dr. Kalishman, he attends lab and theory courses. He has done lectures for us. He observes our faculty. He participates in final testing for our paramedics. He regularly attends the JO and the medical direction committee meetings. He assisted us in teaching our community paramedics the last time we offered it. He frequently sends us research articles and articles of interest regarding teaching at CNM and the EMS program. He reviews and approves our exams, our program minimums, and our assessment outcomes reports. He reviews every single report from every single class, EMT, first responder, all the way through the paramedic level. Our community EMS update, we will be offering the next community paramedic cohort in fall 2017. And just to make you aware, the first semester is completely online and the second semester is online with a clinical and lab component. We'll see here. So the first semester, here is what the coursework looks like. And again, that is available all online. The second semester is online except for the clinical and lab experience. Things that we're doing, aside from primary education here, we're participating in the regional conferences. We hope to participate in the Socorro Fire and EMS Expo, which we do every year. We have assisted Gallup with a combo refresher, a first responder, and an intermediate class. We are currently partnering with Bernalillo County regarding the new National Registry CE package. We consistently teach New Mexico transition courses, and I believe that our pass rate at the state is a 100% pass rate after completing a transition course. We have assisted our simulation department with air care and air methods training contracts. We are very excited about a dual credit academy that is going to start in 2018 with Rio Rancho Public Schools. We are partnering with them and their juniors and seniors, and we will be offering a first responder as well as a firefighter 1 dual credit program out at our AMREP Rio Rancho campus. We are consistently participating in interdisciplinary scenarios with criminal justice as well as respiratory therapy. We have hosted another dual credit first responder course at Bosque School. We have implemented students who come into our EMT basic and intermediate programs are currently receiving kits that include a very nice stethoscope, a blood pressure cuff, assessment tools at the basic level, and at the intermediate level it includes the tools necessary for more invasive skills. This is assisting our students with taking ownership of making sure they show up prepared for class, just like we hope they show up prepared for a shift. And it also greatly decreases our costs as well. We are participants in the SunPath grant, which I will discuss a little bit more at the meeting. We currently hold the chair position at the New Mexico Joe, and we have been piloting using theater students as live patients for our classes at all levels. What we really want to know, we'd like for you to come to the advisory meeting ready to discuss the following things. About how many EMT basics, intermediates, and paramedics would you say as a service or department that you hire annually? How many do you need to hire? What are your minimum requirements for entry into your department? Do we feel like CNM is currently meeting that need in conjunction with the other institutions? What do you like about CNM graduates? What can we do to better prepare our CNM graduates? What do you need from CNM as a community partner? When we have the meeting, we will ask that you fill out our program resource surveys. We'd like for us to be able to approve our 2017 goals, or if you have ideas to add as a goal, please bring them to the advisory meeting and we can vote on them at that time. We'd love for you to meet with our students and we'd love for you to meet with our faculty, and please make recommendations for our program. Just some examples of community outreach that we've done in the past. We often do campaigns for students to buy t-shirts to support different causes, such as breast cancer awareness. We do participate in Light the Night as a first aid tent group. We also have participated in St. Box in the past several years. Pictures of our grads and our students. We're grateful to them for choosing CNM as the place that they came for their schooling. I thank you so much for listening to this, and I hope that you come to the advisory ready to chat with us and help us understand how we can be good partners to you for EMS education. Thanks so much and have a wonderful day.